everybody. Can I, real quick, have a raising of hands of how many nurses I have in the audience tonight? Very good. And that's exactly what I expected. So this presentation tonight is not just for nurses. It is really for everybody. And I hope you can all take something away from it. So my name is Libby. I am a holistic nurse and a nurse educator. So I'm self-employed, entrepreneur, and I work in education. I've been a nurse for 16 years. So when I was asked to do this talk, my mind went in a lot of different directions because there's a lot that we could talk about within the field of nursing and within the larger field of healthcare. Eventually, I drilled down to this. So I did a lot of reflection, a lot of writing, trying to figure out what do I want to share with people? Like, what do I really want to share with people? I've given a lot of lectures in my day. I didn't want this to be a lecture. So I came to this, empowering nurses to be the leaders healthcare needs. Because this is a story about my journey in nursing and some of my experiences and my hopes for the profession of nursing. So I'm going to take you through a little bit of my journey from a nurse on the edge of burnout. And if you've never heard of burnout, it is just something that many healthcare providers go through where they've cared and cared and cared so much and haven't cared enough for themselves. So I'm going to talk a little bit about that and take you from that to where I am today, which I feel is thriving. And I haven't left nursing, I'm still in it. So that's the story I'm going to share. I'd like to start with a little bit of my background. I come from a long line of nurses, and I sort of resisted nursing because of that at first. My personality is more rebel, so to go along with like what the rest of the family had done was really not in my nature. But when the time came to choose a major and to really think about what I was going to do with my life, it fit. So both my grandmas were nurses. One was, well, in the nursing field. One was a CNA. She worked very hard in a nursing home, and if you know any CNAs, you know how hard they work. She worked as a CNA in a nursing home until she surpassed the age of many of her residents. So at that time, she switched roles and started as dining room hostess. So she was still caring for the elderly without the heavy lifting. My other grandma was a nurse for several years until she decided to go on the road with my grandpa driving truck so they could be together more. My aunt is a nurse, my mom is a nurse, my sister's a nurse, you know I'm a nurse. So, this is apparently what we do. We're all different kinds of nurses, are and were. Both my grandmas are passed. But I think we would all agree that nursing's not really about what you do or where you work. It's really about who you are and how you think and what you hold to be valuable. So while we've worked in many different areas from each other, we're all that at the core. Needless to say, I was very proud when I finished my college education with a Bachelor's of Science in Nursing, and I became a registered nurse, so I was upholding this family tradition. And by that point, I had let my rebel self go enough to be kind of proud of that I was kind of taking this forward. I started out my career working in a lot of settings that you would expect to see a nurse working. So the hospital, of course, is probably the first setting that comes to mind. I worked in the community a lot, between clinics and schools, lots of outpatient settings, a lot in mental health, in the community, in patients' homes, and even did some work in a jail. So I saw a lot of different settings, and I got a lot of different experiences early in my nursing career. It didn't take a long time before I was feeling kind of like this. So I had done a lot of work in places where shifts were very long, we were understaffed, and you could see patient care compromised day in and day out. And to see that, and to witness it, and know that I was part of it was pretty exhausting. I did not have the resources to be what I felt was a good nurse. I didn't have the time to sit with my patients and be what I felt was a good nurse. was not empowered. I did not feel empowered to be a good nurse. Ugh. Are y'all down here with me? Yeah. So I'm going to kind of leave you there on that edge of my burnout. Now, don't worry, I'm here. It's okay. But I'm going to leave you there for a minute and take you back to the basics a little bit so that we can cover the ground, the foundation of what is a nurse and what is a nurse's role. So when I was preparing for this presentation, I thought, well, I want to gauge public perception. You know, what is it that a nurse does according to all of you? So I did that in the best way I could think of. I asked a Facebook question, put it out to social media. Yeah, that's what we do. And I took the responses. I got quite a few responses. I took the responses and kind of started filtering through them all, and how many of this word did I get, and so on, and I created a word cloud. I also took this kind of information, went online in general and looked, is this kind of accurate with what I can find on the internet at large? And yeah, it was. The public views nurses to be caregivers. Seems accurate, right? We're compassionate, we're educators, we're advocates. Nursing is the most trusted profession out there, and that's for many years in a row now. I mean, there's lots of different responses here. The smaller the word, the fewer times it came up in the responses is how that works. So I want you to look at this word cloud. I do have to grab a card for this part because I don't have this memorized. While you're looking at the word cloud, I'm going to read to you the definition of nursing from the American Nurses Association. So this is current. As I read the words and you're kind of looking at the cloud, I want you to look for similarities and differences. Nursing is the protection, promotion, and optimization of health and abilities. It's the prevention of illness and injury, facilitation of healing, alleviation of suffering through diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. That's all one sentence, by the way. But what did you catch? Advocacy. I was so happy to see advocate come up in both the definition from the American Nurses Association and the public perception, because advocacy is exactly what I hold to be most valuable as a nurse. Being a patient advocate is number one to me as a nurse. And to me, patient advocacy doesn't mean going to bat for you, it means going to bat with you, collaborating with you, so that you can meet your health and wellness goals. So this really encouraged me, and it also made me reflect a little bit further. That's exactly what I was missing. I didn't have the resources to be a good patient advocate, in my mind. I didn't have the time in the settings I was working in to be a good patient advocate, and I was not empowered to be a good patient advocate. Because nursing is a blending of science and art. So the two really are inseparable. This is what nursing is. The science of nursing is that we provide evidence-based care, and we do that through the nursing process. The nursing process is doing assessment, making a nursing diagnosis, identifying outcomes or goals, planning and implementing care, and then evaluating how all of that went and doing it all over again. This is the process of nursing, the science of nursing. The art is how we do that. So we do this process in a caring and respectful way, supporting spirituality, supporting your healing with empathy, compassion, and intuition. This was what was going wrong when I was on the edge of my burnout. I was doing the science of nursing. I was doing it every day. I didn't have time to do the art of nursing, which was really important for me. Don't ask what the world needs. Ask what makes you come alive and go do it. Because what the world needs is more people who have come alive. I didn't need to leave the profession of nursing. And that's kind of where I was at, thinking I might need to find something else to do. I didn't need to do that. I just needed to figure out a way to come alive within the profession of nursing. I kept digging in, and I go into history because I think we can learn a lot about where we're going based on where we've been. Florence Nightingale. She was the mother of modern day nursing. She was a warrior of a woman and a rebel in her own right. So if you ever get the chance to read a little more about her, please do. Florence was a nurse almost 200 years ago and did most of her nursing work during wartime, but she had a vision for the profession of nursing that was far bigger than acute care or working during wartime. It was far beyond her years. Her vision for nursing, which she never really got a chance to fully do, was that nurses would be doing prevention and wellness work, and we'd be doing it so well that we wouldn't have a high need for acute care. Wouldn't that be awesome? We're not there, right? But the tide is turning, and we are moving in this direction in healthcare. I'm confident of that. So it takes a while, I guess, 200 years. This is another model I kind of came across and started using when I was thinking about what am I going to do with my nursing career to come alive. This is the side I've been working on. If you look at this paradigm, it's somewhat self-explanatory. This was created, by the way, by Dr. John Travis in the 1970s. It's been updated several times since then, so it's been around for a while. It's still in use today. The left side of this paradigm shows the illness side, and the right side the wellness. So our system, our healthcare system here, does a really good job on this illness side of the spectrum. After all, you go to a doctor, you go to your provider when you have signs and symptoms of illness, right? Maybe even disability. And our system and our providers do a really good job at treating you and helping you up a step or two on this paradigm. Sometimes even to that neutral point. And you can see the neutral point is defined as no discernible illness or wellness. A lot of people believe that no discernible illness must mean wellness. What else could it be? But this continuum or paradigm shows that you can go further than that toward high-level wellness. And this is where I feel like there's a huge opportunity for nurses to do their work. I think this is where Florence Nightingale, almost 200 years ago, imagined we'd be doing the most good. So this is kind of the direction I started going in. I wanted to find a way to come alive within my nursing practice, doing wellness work. Couldn't find anything. I went looking for jobs within healthcare systems that would support this kind of work. It didn't really exist. This has been a few years ago, 7, 8 years ago. So I couldn't find anything at the time, and I decided, all right, well, I'll just do my own thing then. And I didn't have a clue about business, but I kind of jumped into entrepreneurship, made up my business name, started working with a WellCare model. What does a WellCare model look like? It does not look like this. Oh, my citations don't show up very well. That's okay. This is ill care. This is acute care. And please don't misunderstand my intention. This is absolutely necessary, and we need to do a really good job of this, and we do. But this is, acute care in the hospital, where you come in, maybe even in an emergency, and you're treated, and then you're discharged. So a WellCare model is collaboration between the nurse and their client. And it's during a time that that client is not acutely ill, because that's really not the time to be working on major lifestyle changes, right? So a lot of times the client will come in at a neutral point, and they're looking to advance on that illness-wellness continuum and work upward toward high-level wellness. Nurses are so well prepared to do this because they're already trained to work in a holistic way. So we work with clients using a holistic model and treating every part of that person, not just the physical being. I want to share a few. a few things that I learned along my road to empowerment. first thing is self-care. This is where I was really lacking when I was on the edge of burnout. This term is thrown around a lot right now, so I don't want to use it too much, but it's hard when there's no other term that really describes what you need to do here. You need to care for yourself. This work of finding empowerment, you cannot do it if you're tired or burnt out. So take care of yourself. No one will hand you this empowerment. You're going to have to do the work to find it. I'm going to show you some tools you can use to get there, but you're going to need some energy. So that is definitely step one. Remember to practice the art of nursing supported by science. That's true nursing work. I often tell people, I may have my master's of science in nursing, but I am not a nurse without the art of nursing. Public health care issues. When you see them, own them. Own nursing's responsibility in creating them and maintaining them. Owning the problems will help you create solutions. It's actually really empowering to say, okay, I had a part in that because I'm a nurse and I need to do something about that. Collaborate and connect. You are not alone. Find other caring professionals who you can connect with and collaborate with, and your clients will benefit from it. Seek out empowering resources and organizations, and I can tell you later about some of my favorites, but essentially you need to find organizations that speak to the kind of nursing you want to do. And there's so many out there, and now with social media, you can absolutely find them and connect with them. And be prepared to step outside your comfort zone. We all know that change does not happen when you're comfortable, so that is coming if you're ready to do the work of empowerment. Now, when I found empowerment, for me, I jumped into entrepreneurship. I started working in nursing education. This won't be every nurse's path, nor should it be. We need nurses in hospitals, in clinics, in schools. We need those nurses who that's their calling and that's what gives them energy, is working in those settings. But we also need nurses in all the places where decisions affecting our health are being made. We need nurses on boards at every level, local, regional, larger. We need nurses in politics, running healthcare systems, running private practices. We need nurses all over. So here's a call to action. This is what I want to leave you with. To the public, to the nurses. Nurses first, so I'm talking to a few select of you. Seek empowerment so that you can be a fearless advocate. So advocating for patients or clients often is a scary thing to do because sometimes you're stepping outside of what's comfortable. Florence Nightingale told us how very little can be done under the spirit of fear. Finding empowerment will help you overcome that fear. To the public, expand your expectations of what a nurse does and what a nurse is capable of. We will deliver. Because a nurse is all these things and so much more. Empowered nurses will empower you.